Hi, my name is Dennis Acosta, and this is my BMS intramuscular checkoff. So first thing I want to do is I want to check the patient's chart. So it's Anna Pavlovsky, allergies or penicillin. Her reaction is hives. And the medication I'll be administering is the influenza vaccine. Next thing I want to do is I want to knock on the door, introduce myself to the patient. Okay, hi, my name is Dennis. I'm a student nurse. Today I'm here to administer influenza vaccine. Can I please get your full name and your date of birth? She's going to state Anna Pavlovsky, 5/5/1957. I'm going to verify that on the chart. I'm also going to verify that on her wristband. Next thing I want to do is ask her if she has any allergies. She's going to state penicillin. And then Ms. Pavlovsky, what happens when you take penicillin? Her reaction, according to her, is hives. So I'm going to check down the chart. I'm also going to verify that her wristband states allergies to penicillin. Okay, next thing I want to do is do my 6 rights. So right patient, Anna Pavlovsky, check here on her chart. Check on wristband, I've already asked her for her name. Right drug, verify that on the chart. So it's influenza vaccine. Right amount is 0.5 ml. Right route, intramuscular, I'll be doing on the deltoid today. Right time, so 5/11/2020, 14:58. So that's the time and date now. And right documentation, so it's on here, and I will be documenting later once I start the medication and once I finish administering it. Okay, next thing I want to do is I want to educate my patient on the drug. So here I have my drug sheet. Hold it here so you can see. Okay. So, the influenza vaccine, so the purpose of this is to prevent flu contraction frequency. So it's going to be 0.5 ml once via intramuscular. Therapeutic class, so it's a vaccine. It's to get immune to the, or build up an antibody against the flu. Mechanism of action is to cause vaccine causes the production of antibodies against the flu. Recommended route is going to be 0.5 ml single dose for an adult. Most common side effects: headache, malaise, pain. And I want to make sure I explain to the patient the purpose of the vaccine, which I just did. Make sure not to mix the vaccine with anything else, just the vaccine and the syringe. And I want to monitor signs of allergic reaction or any type of reaction to the vaccination once I administer it. So once that's done, I want to provide a safe environment. I want to make sure the bed's all the way lowered. I want to make sure 2 guardrails are up. Make sure the patient has the call light. Make sure bed's locked, no clutter, anything like that. Then I want to make sure so everything's good, no hazards. I want to make sure I close the door. So I'll go ahead and do that, or the curtain, and then I want to calculate my dose. So next thing, calculating the dose is going to be pretty easy. This is 0.5 ml of the influenza vaccine. I have 1 ml syringe, so it's basically just going to be half of the 1 ml, so 0.5 ml, so half of the syringe. Next thing I want to do is sanitize my hands, that way I can show the patient where the locations are at. So the first one is going to be on the deltoid. So this is my IM landmark. So this is going to be roughly 2 to 3 fingers below the acromion process, which is the bony prominence here. And then beneath that, you're gonna have like a little triangle area that you can administer the shot, and it's going to be on the opposite side of the axilla. The next place is going to be the ventrogluteal. Let me get up so I can go ahead and show you. So you're going to find the greater trochanter. So it's going to be the bony part right here on your upper femur. Okay, so what you want to do on there is you want to go ahead and put your palm on the greater trochanter. You want to do like this with your fingers. You want these 3 fingers to face the front of the patient, and then these 2 to face the rear, so towards the groin and then towards the buttocks. So you're going to go ahead and do this with the greater trochanter here. You're going to find a little spot in there, and that's where you administer the medication. The last area, let me go ahead and get back up, is going to be the vastus lateralis. So it's going to be underneath the greater trochanter, above the knee. You're going to find the midline location in between both hands on the outer side of the thigh would be a correct spot. So once the patient understands, I want to go ahead and gather my supplies. So I'm going to have my 1 ml syringe. I am going to have my 23 gauge needle. I'm going to have my influenza vaccine vial. I'm going to have my tape so I can, label my vial and my syringe. And then I have my gauze and my alcohol pad here. Here I have my clean gloves. And then I also have my syringe box here. Okay, once that's done. Okay, next thing I want to do is I have all my necessary equipment. That's good, and I have my record here to make sure everything's good. Before going on, I want to go ahead and recheck the prescription so I can get everything ready. So Anna Pavlovsky, checking the paper chart, verified date of birth, 5/5/17, penicillin is her allergies, influenza vaccine, be half an ml, intramuscular, 5/11/2020, 1458 is the one I'm going to administer, which is now, and dispense injection at half an ml. Okay, so what I want to do is just go ahead and sanitize my hands. Okay, I'm going to use a 6 right, so make sure it's Anna Pavlovsky, right patient, right drug, influenza vaccine, right route, like I said, amount, 0.5 ml, right route, intramuscular, and deltoid, right time, 5/11/2020, 1458, and I'll just document that it's been started, that I started the process of administering the medication. Once I do that, then I want to go ahead and I'm going to grab my vial. It's a multi-purpose vial, so for this case, it's going to be my first time using it. So I want to go ahead and label it. So I got a basic piece of tape here. So I'm going to go ahead and write my initials, BA, then 5/11/2020, and then 1458 is my time. Go ahead and label here. All right. Next thing I want to do is open up my alcohol pad. I'm going to clean this for 30 seconds. Okay, I'm going to go ahead and place this here to the side. I'm going to leave the alcohol pad on top. That way I know that I've already sanitized the top of that. Next thing I want to do is go ahead and grab my syringe and my 1 ml syringe and my 23 gauge needle. I'm going to go ahead and take out my syringe. Make sure not to contaminate the inside of the plunger. And I want to go ahead and get my needle. I'm going to go ahead and put it on. Okay. For that, I am going to go ahead and take it out using the rainbow method. I want to go ahead and bring it down, being sure not to contaminate the inside of the plunger. So 0.5 ml, I'm going to get my vial, take out my alcohol pad so it's clean, place this on top. I'm going to bring down the plunger, putting air into the vial, and then I want to go ahead and take out 0.5 ml. Once again, being sure not to contaminate the inside of the plunger. I'm going to flick it, make sure I get all the bubbles out. I don't see any bubbles or anything. I'm going to bring this up a little bit higher. Okay, so I got the amount that I need. All right, I'll flip it around. Okay, I'll this here. I'm going to recap my syringe. So it's recapped. Next thing I want to do is I'm going to label. So I'm going to grab me a piece of tape here. I'm going to label the patient's name. So it's Anna Pavlovsky, flu vaccine, 0.5 mLs, initial, the today's date, which is 5/11/2020, and then time 1458. Okay, I'm going to go ahead and place this on here, being sure not to cover the amount that I got to put here, the medication administration. Nope. Okay. All right, so again, 0.5 ml, perfect. Okay. Oh. All right, so I have this ready. All right, once I do that, now I'm going to go ahead and bring this with me along with my gloves and pretty much it in my disposal box and alcohol pad, which I have here, and a piece of gauze. So now I'm at the patient's bedside. I'm going to go ahead and get my 2 identifiers, so patient's name, date of birth. I'm going to verify that against their wristband and again on the chart. Now I am going to, before I do anything else, I came in, so I verified the patient. I'm going to go ahead and sanitize my hands. Okay, so right patient, Anna Pavlovsky, right drug is going to be the influenza vaccine. Right amount, 0.5 ml, which I already have here. Right route, intramuscular, I'll be doing the deltoid muscle. Right time, so it's 5/11/14/58, which it is now, and I'm put documentation. I'm going to start giving the medication, and then what was it called? So that's good. I check my 6 rights. Now I want to go ahead and get the patient ready. So again, sanitize my hands. All right, I'm going to put on my gloves. So put on my clean gloves. Okay. Okay. As mentioned earlier, today I will be administering the patient's shoulder. So what I'm gonna have them do is sit down, put their arms on a stable object, and just relax their arm. Make sure the importance of that. If I was doing on the ventral gluteal, what I would want them to do is lay on their side, flex the upper part of their hip and their knee. And if I was doing the vastus lateralis, I can either have them sitting or I can have them laying supine. Okay, so once I do that, I have the patient's deltoid here. I'm going to go ahead and get my alcohol pad. I am going to clean from the inside, going out. I'm going to let the deltoid dry. Then I am going to uncap my syringe. Got this here. Using my non-dominant hand, I want to go ahead and place my arm or my hands here about 1 to 1.5 inches apart, separating the skin. Okay, and then I am going to go ahead, drop this in like a dart, 90-degree angle. I'm going to drop it in here. I'm going to administer the medication slowly, holding it in for roughly 5 seconds. That I'm going to take out this and put a piece of gauze on there. I'm going to put a little bit of pressure. While I do that, I'm going to go ahead and recap my syringe. And then I'll just go ahead and put in the sharps disposal. Okay. Once I did that, I'm going to hold this for a couple more seconds. I'm going to take it off. Assess for bleeding or any adverse reactions. It looks fine. Hardly any bleeding. I'll just go ahead and put a Band-Aid on there. I'll go ahead and dispose of all this. Take off my gloves. Okay, next thing I want to do is I want to go ahead and document that the medication has been given, no adverse reactions, anything like that. Want to make sure the patient is in a good position, beds all the way lowered. They have a call light and reach. I have 2 side rails up. They have what they need, beds locked. See if they need anything else before I leave. Make sure the patient's comfortable. If everything is good, I'm going to open up my privacy curtain or open up the door. I'm going to sanitize my hands on the way out. And that's it. That is my checkoff.